Hello everyone, drberkkkaratas. I will talk about BOODEP.com, the ejaculation control program. This program is specifically designed for individuals to apply it to themselves remotely and learn how to control ejaculation. I already implement this program in my own practice, where patients come to me every 2 weeks to follow it. We have been implementing this program for about 7-8 years, but for those who are far away, unable to come or feel shy, we have also prepared this program online. There are already many such programs in America and Europe. It's also available online. But of course, the culture there and the culture here are different. We have also adapted this program a bit to fit our culture. I will talk about it shortly. This program is personalized. It lasts 8 to 12 weeks and consists of 5 stages. You work for 20 minutes a day. It has proven success, and we use a variety of technological devices. Now, the most important thing is that it is personalized. My late teacher used to say this: maybe there is no disease, there is only the patient. He used to say that if you treat everyone the same, you can't be a very good doctor. I'm really trying to hold on to that, because what everyone is experiencing right now, what they have experienced in the past and what they will experience in the future will not be the same. Problems and desires are different from each other. In the past, it was a very bad, traumatic job. Someone with masturbation syndrome can also apply this program. Normal masturbation, someone who masturbates appropriately or engages in sexual relations appropriately, is different from applying this program. Of course, there is a difference. So it's a personalized program, 5 stages. I won't explain the stages one by one here. You can also learn about the stages at BOODEP.com. But the important thing for us is this. I always say this: to control ejaculation, we need to manage our physical arousal. This also involves muscle and breath control. You need to learn this. So how do we work with a vibrator and masturbators? We work on these levels step by step, and there's 1 level, then the 2nd level, then the 3rd level, and it continues with the 4th and 5th. We need to learn to control the ejaculation reflex point. We need to learn the stop-start technique. The stop-start technique is, of course, different in a relationship. We need to learn these things differently during masturbation, and we continue like this. I always say the vagina is a wet, slippery, warm, and soft place. Are you ready for this? Because in the masturbation we've done so far, it's generally dry, not slippery. And we've been stimulating a certain part of the penis with a firm grip or by rubbing, which doesn't really mimic sexual intercourse at all. We usually aren't ready for this, but in this program we're trying to get a bit more prepared for it. I always say that erection is a reflex situation. Erection is a reflex situation. Ejaculation is a controllable situation. Finally, of course, 5. At this stage, in terms of experiencing and giving pleasure in the program, we apply what we've learned to the relationship, a program that lasts from 8 to 12 weeks. This duration, can it be shorter? Can it be longer? These are questions that are often asked. I think it takes a certain amount of time to reinforce behaviors, to achieve those behaviors, and to reflect them in your life, applying them to your sexual life. So we don't just learn to drive a car theoretically and then immediately get in and drive it. We're going through certain practical stages. This should also be evaluated in that way. Everyone's learning, and reinforcement curve progresses at their own pace. Some they can learn in 6 weeks. In fact, some learn in 14 weeks, but it won't be finished any earlier. That's the answer to the question. We work for 20 minutes a day. That's very nice. It's something provided by the World Bank. What are we doing for 78 years? He says, for example, we dedicate 4 years to drinking alcohol and 28.3 years to sleeping. When I saw this, I did a little calculation myself. So 10 weeks, let's say we will work, it turns 7 days into 70 days. How much are we going to work each day? We will work for 20 minutes, 20 minutes a day. For 70 days makes 1,400 minutes a day. If we divide this by 60, we get 23.3. So throughout our entire lives, we can achieve control over ejaculation with just 1 day's worth of work using this exercise program. I talked about proven success. As I mentioned at the beginning of my speech, this is something I found. It's not a program. Or 1956. After Simmons discovered the stop-start technique in 1956, We reached this point as a result of a series of accumulated knowledge over the years. Recently, Kobayev and Zama have also included verbatory masturbatory in these programs, and this is already a program that has been applied and proven over the years. The duration of ejaculation increases by about 5 to 11 times. Our goal is a duration of 5 to 6 minutes or 7 to 8 minutes. But of course, setting a specific target here isn't something we really want. We want individuals to fully achieve control over ejaculation. The satisfaction of the partner is also around 87% at the end of this program. I said we use a number of devices. I put representative images here. We use special devices for individuals. For some, for example, if the sensitivity of the glands is high, we use vibration. We especially use the devices more, or for example, traumatic. If there's a masturbation syndrome, we use artificial vaginas. This varies from person to person, the devices you use. So how can we participate in this program? First, we can visit BOODEP.com. When you visit here, there is a sexual assessment form. This program, let me put it this way, is not a program where you can just say, I'll pay the fee and join. I need to decide whether it's suitable for you. So you definitely need to fill out this form. Once you fill out the form, you will receive an email at your address saying, yes, you are suitable for this program, you can join. There are registration and payment details there, and so on. After doing this, we will send the devices that are suitable for you to your address. Then, the start date of the program will be determined and your 8 to 10 week journey will begin. We will have a meeting once a week, but the meetings won't be face-to-face. They will mostly be through email, or it will be through voice messages on WhatsApp. I will say to you once a week. For example, in the first step, let's do the following. Then, a week later, you will give me your feedback. When you report back to Hopi, and I will tell you again that we will continue like this, like this, like this, like this, like this, like this. It is a situation that increases my workload a little bit, but from a distance, this is one of the best methods that can be done as an educational program. In conclusion, the BOODEP in ejaculation control program is a program where individuals learn to control ejaculation on their own. As I always say, erection is a reflexive situation. Do not interfere with your erection. Ejaculation, on the other hand, is something that can be controlled. You can learn to control your ejaculation. Thank you.